Hi, Dr. Kevin M. Windisch from Sparks Pediatric and Adolescent Medicine. Welcome to our video series for students. This is our website and phone number for you. If you're not familiar with our Facebook page, we invite you to come here and learn a little bit from us. If you're a parent watching on, that's okay, welcome. Do realize that these videos are not in lieu of doctor's visits for your children. We can't help you over the internet, nor can we help you over the telephone. If you have questions about your children, please call us at our office. The phone number is listed here, 775-359-7111. If you'd like to set up a rotation as a medical student or a graduate student in physician assisting or nurse practice, give us a call. We'd be happy to help you. Today, what we want to talk about is Group B strep sepsis prophylaxis in the neonate. And I'm going to reference one article today. If I can get my pen to work here. There we go. So we want an article by Varani. Oops. J. McGee. And Schrag. Prevention of perinatal Group B strep disease. And this article is published in the MMWR. For those of you not familiar with the MMWR, that's the Morbidity and Mortality Weekly Report from the Centers for Disease Control in 2010. Okay, so this is the article we want to talk about. Why do we want to talk about this? Well, Group B strep is the #1 cause of sepsis and death for neonates. It's very common. It's also very rapid acting, meaning an infected infant from the time of initial presentation till the time of death can be as little as an hour from the time you figure out there's a problem. So it's important to recognize this early and do what we can to prevent it, because quite honestly, picking it up later may be a day late and $1 short for the kid. These guidelines were originally presented in about 1996, and they've made a huge difference in elimination of Group B strep for early Group B strep in the neonate. Realize there's kind of two peaks of Group B strep. I think there's 30 hash marks here. And they go something like this. These guidelines, whoops, are designed to pick up and eliminate these children within the first 24 to 48 hours of life. Does nothing to help the kids who present later. All right, so the first question that invariably must be answered. Are there signs of sepsis? Sorry, my pen's giving me some grief today. If there's signs of sepsis, this child is septic, needs antibiotics, transfer to the ICU, CBC, culture. If it turns out there is group B strep, lumbar puncture. Okay, the rest of these guidelines are for kids that are not septic appearing. Is there maternal chorio? If yes, the baby needs antibiotics. I'm sorry. I've got my yeses and nos backwards here. Nope, I'm right. Baby gets antibiotics. CBC, culture. If there's no maternal chorioamnionitis, then the question is, did mom need group B strep prophylaxis? This would be a positive culture for mom or a history of a baby with GBS. If the answer is no, then we just give routine care. If the answer is yes, then the question is, did mom get antibiotics in the form of AMP, penicillin, or Ancef greater than 4 hours? For some reason it doesn't want to make my, there we go, greater than 4 hours. Yes. Then observe for 48 hours. If the baby's over 37 weeks, then you can discharge home in 24 hours if you can assure follow-up on a PRN basis. And this is supposed to be an O here. My pen is just not cooperating with me today. If mom did not get antibiotics for greater than 4 hours, then the question is this a term baby greater than 37 weeks gestational age who did not have prolonged rupture of membranes? As defined as rupture of membranes greater than 18 hours. If this is a yes, we can observe for 48 hours. With or without CBC at 6 to 12 hours. If this is not a term infant, so we're less than 37 weeks gestation, or we have ROM greater than 18 hours, so prolonged rupture of membranes, then that's supposed to be a Y. Get a CBC in culture, observe. It's supposed to be an E. SERV for 48 hours. That's really all there is to it, and it's these last two steps here, whoops, that really are the key to these guidelines. Now, people say, well, gee, you're talking about is maternal GBS prophylaxis indicated? And when do we do it? How do we do it? All of that. The reality is I'm not going to get into that. And the question of why I'm not going to get into that is answered by this simple comment. That's up to the OBs. I'm not an obstetrician, and I don't get to make the decision who gets treated, who gets antibiotics, who doesn't, who gets cultured, when they get cultured, etc. We presume that it was done right, but the fact of the matter is the baby you have in front of you is the baby you need to treat regardless of how they got here. So I want to focus on the pediatrician end. I'm a pediatrician. This is what I do. This is how we approach the children. And don't give a whole lot of thought as to how they got here. The fact is they're here right now, and we have to attend to them. So I hope this helped to elucidate this a little bit for you and remove some of the mystery. Do again remember, this does nothing to prevent late group B strep, stuff after the first 48 hours. And so children under 30 days of age definitely under 28 days of age, with fever without source, need a full septic workup, and empiric antibiotics. If we can be of assistance in our office, if you'd like us to see your child, give us a call at 359-7111. That's area code 775. Like us on Facebook. Do remember we can't treat your child over the internet or over the telephone. We'll see you next time.